Hi, I am Dr. Anderson Acunha, talking from the Midwestern University in Arizona, and this video lecture will show you how to perform a transverse abdominal plane block, also known as a tap block. I will be using a dog as a model here, and I believe that this technique can be modified for the species you are working with. So first of all, let's review the materials. This tap block is performed by ultrasonography. So this is an ultrasound guided local anesthesia block. Obviously then you have to have your ultrasound connected to a specialized probe. You have to have a linear probe in order to perform this block. Linear probes are designed to observe very superficial structures. And as you will see, this area is very superficial. You are introducing a needle inside the abdominal wall. Bupivacaine is your drug of choice. It will last 4 hours, and I will invite you to review the dose for your species before you start your procedure. I usually use an extension set, so in this case here is a short T port that I use. This allows me to get a better handling of the needle. My syringe will not be influencing how I move my needle. The needle size will depend on the patient size. So you can use a 22 gauge, 2-inch long. Oftentimes for smaller patients, I like to use a 26 gauge, 2-inch long needle that can be easily visualized with the ultrasound. This is not a sterile technique, but you will do wearing procedure gloves after clipping your patient's hair and scrubbing, just as you do for any surgery. You also have to have ultrasound gel or alcohol to improve the contact of the probe and the skin. Your patient will be positioned in dorsal recumbency. You will identify where the umbilicus is. In this case, it's here. And where are the caudal portion of the patient's ribs. And your probe will be positioned parallel to the caudal portion of the ribs. The needle will enter through the skin 2 centimeters away from your probe in a 30 to 45 degree angle. Again, you are going to introduce this needle inside the abdominal wall, which is not very thick. As you can see here also, I have my syringe with bupivacaine connect to the T port and then connect to the needle. You will be positioned in front of your ultrasound, and in this case, as you can see, my student is looking directly at the ultrasound. He can easily observe where his probe, needle, syringe is, and he has total control of the situation. So position yourself in front of ultrasound and patient. In this slide, I want to show you many things. So first of all, look at these white lines. So I will explain this later. There are at least 4 white lines that are very clear in this picture. We have this marker. This is your ultrasound indicating where the needle is going to be showing up. And also, very importantly, this is your 1 centimeter mark for your patient. And we are, after reviewing what these structures are, you will realize how superficial the structures you are trying to identify are. So let's go to the next slide. Now I highlighted in green the superficial and deep fascias of the internal abdominal oblique muscle. And I did highlight in orange, again, the superficial and deep fascias of the transverse abdominal muscle. This deep fascia of the transverse abdominal muscle is also known as peritoneum. So during this technique, you will avoid entering with the needle through the peritoneum. If you are there, you are way too deep with your needle. You are inside the abdominal cavity, all right? Now, without the highlights, you can clearly see those white lines, right? And the needle is going to be entering this specific area highlighted in green. This is the transverse abdominal plane site where you're going to deposit your bupivacaine. This is the area in between the deep fascia of the internal abdominal oblique muscle and the superficial fascia of the transverse abdominal muscle. In this video, we will observe a positive or successful injection of bupivacaine at the transverse abdominal plane space. As you see, these two white lines will start opening in a very organized manner. And that is the positive visualization of your block. So let's watch the video. You can see the shadow of the needle. Let me highlight this. This is the shadow of the needle, and this void between one fascia and the next are going to be created as we inject the bupivacaine. This next slide will show you an unsuccessful injection. So this needle, as you can see here, this is the shadow of the needle, right? And this injection will be performed at an area that's not in between those two fascias that we were looking for. So what's going to happen, since this is an intramuscular injection, you will see this explosion during the injection, during the first injection. So let's play the video. That is an indication that your needle was not in the right plane. So let's watch this again one more time. We have skin, intestines, peritoneum, the dot indicating where the needle is going to enter, and let's play the video. You can see the peristaltic movements, the peritoneal wall moving with the peristaltic movements. Now the needle is entering through the skin, through the muscles. Test injection was perfect, and you can clearly see this void being created and those two lines opening as I was describing before. In conclusion, this is a very easy block to be performed. The only disadvantage here is that you have to have that specialized linear probe that can be challenging. However, if you have that, I believe you can apply this technique for many different species. The tap block will provide analgesia for the abdominal wall, not for the internal organs. So it's important to realize that. I was describing this technique here in a dog, but again, you can modify the technique for the species you're looking for. And please use pain assessment scales afterwards to understand if your block was or not successful. These pain scales have to be species specific, then choose the appropriate one for the patient that you are working with. I appreciate your attention.